Let's react to a video by BBC called How a Hair Transplant Can Change Your Life.
So then,
Yes.
what made you decide to get a hair?
Look at that really funky, cool stage that they have in the background with those mannequins. Whoa.
Decide to get a hair transplant?
Well, what it was, I was receding, and then gradually as I got older, it really affected my confidence.
You know, out of all other words, we hear, I think, the word confident the most when it comes to people describing what they're looking for when they get interested or come in for a hair transplant. And that's why we named our product brand Feel Confident, because we felt like that was what was most commonly described to us as like what people were lacking or what they felt that they were looking for when they got interested in a hair transplant. So if you're interested in hair loss therapy, head to feelconfident.com for more information.
What age did you start receding from?
I could tell probably from 19.
For some patients, it really starts very early. You know, this whole process of hair thinning, recession, male pattern loss can present itself very early, 15, 16 years old sometimes. And there are some patients who end up with like a Norwood 6-7 pattern as early as like 19 years old. So that's why when people tell me, oh, hey, isn't there a certain age that you have to be to get a hair transplant? Well, as long as you're over 18, you really have, reached that age of maturity to at least make decisions on your own as far as, we're concerned about, at least in this country. And it really comes down to what your pattern is, what your goals are, if you're on medications or not. It's not just an age that you have to be eligible for a hair transplant.
I was starting to go thin at the sides.
And well, we have a picture here of how you used to look.
There are some concerns, of course, with operating on younger patients. One is that you don't know exactly what their ultimate pattern will be, so it becomes more difficult to plan a hair transplant properly. Again, you can always move some grafts around, but if you're trying to create a result that will last for them for years to come and to be something that, 20 years later, they won't regret it, right? Because that's the goal. Then it's, of course, easier to do that type of planning and to execute properly the older somebody is. Though there are some exceptions, as we've described, in some young people who've lost a ton of hair and could be eligible for hair transplant earlier in life.
Yeah.
So that must have been quite...
So I'm looking at this gentleman, and what I'm seeing is that surely there's frontal scalp loss, there's loss along the temples, the frontotemporal corners have recessed back as well, and overall, he definitely looks older than his stated age.
So that must have been quite hard at a young age to have receded like that. Was that just really just knocked your confidence?
Yeah, it did. I wasn't happy with him myself.
Wow, that person's like in complete shock there, sitting on the left. Well, he doesn't look that bad.
It was a miserable time.
How did that affect relationships you had?
I was actually on online dating websites, and someone actually turned around and said, "Oh, you're nice looking, but I thought you had hair." So that was like the iceberg for me. That's when, like 5 weeks later, I said to my parents, I'm booking hair transplant. Then 5 weeks later.
So what I try to do with this channel, especially with our hair loss material, is to try to get you guys to think a little bit differently. So if you're experiencing hair loss, the next reaction or the next thought shouldn't be, oh, now let me go get a hair transplant. It should be, well, why is this happening, right? So understanding the cause of the hair loss is important. And again, you don't have to be able to figure this out on your own. There are doctors like myself who deal with, this type of stuff all the time. So reach out to somebody who understands hair loss and get a consultation, find out more about why it's happening to you. And then it's about the treatment, but the treatment isn't always surgical. Sometimes the treatment can be medical therapy, and we've discussed that at length on this channel in many, many videos. So the reflex shouldn't be, oh, hair loss, let me do surgery. It should be, let me figure out what it is. Let me figure out which medical therapies might make sense for me, right, to preserve your hair in the DHT sensitive areas. And then maybe a transplant can help augment the areas where I've lost a significant amount of hair. So that should be the thinking. So just hope you guys get that over the course of these videos.
I flew to Turkey.
What did you pay for it in Turkey?
About 1,900 to 2,000.
He went to Turkey. So we've talked again a lot about this. People going to Turkey and other countries, many different countries, to get their hair transplants done. So even for Turkey standards, $1,900 to $2,000 is relatively cheap, and you're going to generally find better clinics in Turkey charging more money, probably at least 3 times that, if not more. So that's, so people ask me like, oh, how do I know which clinic in Turkey to choose? Well, if you're going to go to the most inexpensive clinic in Turkey, that's probably not going to be where you're going to find the best work being done, or the place where the surgeon actually is involved in your care. So just keep that in mind.
And how many follicles did you have taken from the back into the front?
I think it was 3.5 I was meant to have, but I think he ended up giving me 4,000.
Yeah, so 4,000 grafts in a single session is a lot. And it's not that it can't technically be done. The problem is when you're really trying to preserve the donor supply for future procedures and improve the appearance of scarring in the back or the donor area, it helps to not do sessions of 4,000 grafts plus unless you're doing, a larger strip procedure and you just happen to get that number of grafts off of the strip. But in Turkey, they almost never do strip surgery. And so almost with 100% certainty, this gentleman and almost everyone who comes through Turkey gets an FUE procedure, which is great. But these larger numbers can sometimes be concerning. Always better, as I say, to do 2 procedures of 2,000 grafts at a time than to do 1 procedure of 4,000 grafts at a time. Your donor will heal better. You reduce the risk of shock loss. You reduce the risk of necrosis of the skin. Lots of problems can be avoided with slightly smaller procedures that are done spaced out. Of course, you need enough grafts to create a difference, but you don't want to go overboard in any one session. Also, there's a lot more emphasis, I feel, placed on the number of grafts transplanted rather than the artistic element of hair transplant surgery, which is, well, how was the hairline designed? What was the overall direction or angulation of the hair? How was the irregularity created to create a very natural appearance? So all of that seems to be typically swept under the rug, and all people talk about is how much did you pay and how many grafts. But it's not just about moving grafts, it's about doing it intelligently and artistically.
Okay, so we have a photo post-surgery. Obviously, you've less hair there.
Yeah.
So yeah, it looks like they did transplant many grafts. They clearly lowered his hairline, and they did create some irregularity at the hairline, which overall is a good thing. This is only a kind of a partial view.
And was it painful? Because your head looks a little bit scabby.
It was more painful, the ache.
Well, yes, it's going to look like that. It's a fresh post-op look. So it's not even just scabs. Initially, it's the actual grafts that you're seeing with some dry blood around. And then eventually it turns into these scabs. And usually by the end of the second week, you should work out those scabs. We have a video on post-op recovery from hair transplant surgery. Make sure to check that out.
That evening, I remember feeling a bit frobby, but once the painkillers kicked in, it was absolutely fine.
Your hair looks amazing now. Yeah, I'm a bit jealous.
So he has his hair combed down. Currently, it would be good to see how he looks with the hair swept up, just for a more fair comparison.
It did have an impact on your mental health. I think you used the word depressed, didn't you? You said you were quite depressed. Has it affected any of your mental health?
I wouldn't say it's affected my mental health, but it definitely affected my confidence.
So what about what Ben said about, people online?
See, there it is again, the confidence, right? That word comes up more than any other.
On dating websites, perhaps, saying, yeah, great, but I need someone with hair. Have any of you ever felt kind of knocked back? Or maybe you haven't even approached someone because you're not feeling confident about your hair.
There are plenty of men and women that are attracted to people with no hair. So keep that in mind, too.
I feel more comfortable approaching a girl if I've got a hat on. She can't see my hairline. But I wear hats all year round. Like, not just the summer, winter time. Even if it's cold outside and it's raining or it's snowing, I'll put a hat on and I'll put my hood up. Like, I will just always wear a hat. So if I was to get this procedure and it was to go well, definitely wouldn't wear a hat as much.
That hat at some point is going to come off, isn't it?
That does, but then I just rely on, my mindset there is, I'll just charm her, and then when I take the hat off, it's not too bad.
Yeah, at the end of the day, it really is mostly about the personality. The hair transplant or the medical therapy, even if it restores your hair. I think people should always be working on their character and improving their character, because that's really the most critical part of us at the end of the day.
Obviously, it affected it badly, but after you had the transplant?
Oh, it was like a new lease of life, especially when I started to get thicker. The confidence grew with the months as the hair grew longer and thicker. Dating-wise, it completely changed the other way.
Has it been an issue with you and approaching people?
Yeah, but I think it comes down to like confidence sometimes, doesn't it?
There it is again. Confidence.
Kind of good game, or have you noticed his confidence?
Apart from his...
And look, a lot of people will say, well, you shouldn't have to get surgery to feel confident. You know, that should come from within. But the two are very much interlinked. I don't think you can take one out from the other because, you know, our physical appearance and how people perceive us is also very important. So the way we are kind of internally and how we feel is in many ways tied intricately to how we look.
Rubbish dancing, yeah, I would say. Yeah, he's confident.
If we're going to, you know, out shopping, then I'll just stick a cap on. It's much easier than messing about with my hair, especially when you've not got much of it. But, you know.
Ben, do you have any advice for our surgery seekers?
Just if you want to do it, just go for it. It's like a life-changing decision for me. I don't ever think about it now. I worry about what hairstyle to have more than anything else.
You know, again, this becomes a very limited discussion when you just think about surgery or no surgery, because medical therapy, as we know, is a huge part of the ultimate success of people who are looking to restore their hair. It's not just about surgery. Since you enjoyed this video, check out our reaction to Heath's life-changing hair transplant journey.